A very good evening. So, welcome to the platform of eGurukul. So, myself, I'm Dr. Ramya. I teach obstetrics and gynecology. So, today we are going to do the FMGE Recall of 2022. So, I have collected some questions which I'll be discussing now, but I think there were plenty of questions in obstetrics and gynecology this exam. And so that is one thing, such an advantage. OBG was very scoring for you all, almost like 40-30 questions you could have scored, right? So whatever questions I could collect, I'm going to speak now as well. Whatever questions you further feel they were there, you can add it. We'll discuss that also now. Okay, right. So let's start the session. So the first question is, what is this? So which fistula is this? So the connection, it is very easy to answer. The connection is between the bladder and the vagina. So as the connection is between the bladder and vagina, so it is the vesico-vaginal fistula. It is the vesico-vaginal fistula. So most common type of fistula is also vesico-vaginal, which is there in this picture. So here what you're seeing is the most common. So most common type of fistula is also vesico-vaginal fistula, right? And another two important points regarding vesico-vaginal fistula. Most common cause of vesico-vaginal fistula in India is obstructed labor. And most common cause of VVF in developed countries is post-hysterectomy, right? So this is the vesico-vaginal fistula. So depending on where the connection is there, you have the different types of fistulas. So this is between uterus and bladder. So it is uterovesical. Cervix and bladder, cervicovesical. Vagina and bladder, vesicovaginal, right? And urethra and bladder will become urethrovaginal. So the image which they gave us was vesicovaginal. I think you all would have answered it correct, right? So next question which we had was, what is a contraceptive present in this? So I think it is written here actually in the image if you see clearly, right? So this today is a sponge. So today is a sponge which absorbs the sperm, sperms and releases nanoxynol 9 and kills the sperms, right? So I hope you all did your exam very well, no? So today is a sponge which absorbs the sperm and releases the nanoxynol 9 and kills the sperms, right? Placenta in horses is epithelocorial. Placenta in humans is. So we all know that placenta is described by three words. That is, human placenta is discoid in shape. It is hemocoroidal. That is, the blood is present from both mother as well as the baby, and it sheds off post delivery. So it is deciduate. So it is hemocoroidal, right? Most common cause of postmenopausal bleeding. So again, this is one of my favorite question. I hope you all did well. So most common cause of postmenopausal bleeding, if somebody asks you, don't do mistake of answering endometrial cancer or cervical cancer, because most common cause of postmenopausal bleeding is endometrial atrophy. So that is senile endometritis. Most common cancer most common cancer causing PMB? Most common cancer causing PMB in developed countries. Then it would have been, it is endometrial cancer. Whereas most common cancer causing PMB in developing countries is cervical cancer. All your questions, whatever you got, everything is from your notes. So you just have to be perfect with your notes, to score a good marks, right? So here the most common cause of postmenopausal bleeding is endometrial atrophy. Endometrial atrophy, right? And most common cancer causing the postmenopausal bleeding is cervical cancer in India. Most common cancer causing bleeding in developed countries is endometrial cancer, right? According to the new MTP Act 2021, more than one doctor is required for how many weeks? So according to the new guidelines, up to 20 weeks, one doctor opinion. From 20 to 24 weeks, two doctor opinion. So here in this question, they have asked how many doctors are required, more than one doctor is required from how many weeks? So it is 20 to 24 weeks. Earlier it was different. Let me not speak about earlier and confuse you. Remember the new one. So according to the new one, up to 20 weeks, one doctor opinion. 20 to 24 weeks, it is the two doctors opinion, right? So MTP Act, new MTP Act, all should know, because second time there is a question on the new MTP Act. So this is the Asherman syndrome ka HSG. This is a classical honeycomb appearance. This is a classical honeycomb appearance. So post-curettage, you have this honeycomb appearance, and this is the Asherman syndrome. So okay, I hope there was one question on the Asherman syndrome ka HSG, right? Most common site of tuberculosis is, so most common tuberculosis or most common site of pelvic inflammatory disease is fallopian tubes, guys. Why the most common site of tuberculosis or the most common site of PID is fallopian tubes? Because fallopian tubes has dual blood supply. So all the infections quickly reach the fallopian tube. So first site and the most common site of tuberculosis as well as the PID is fallopian tube. So tuberculosis causes endosalpingitis, from inside to outside infection, whereas PID will cause exosalpingitis. And because the tubes get affected in tuberculosis, that is why 70% of them with tuberculosis, genital tuberculosis, will present you with infertility. So the most common symptom of TB, genital TB, is infertility, right? Which hyperthyroid drug is safer during the first trimester of pregnancy? So the drug of choice for hyperthyroidism in the first trimester of pregnancy is propylthiouracil. So in the first trimester it is propylthiouracil, whereas in the second and third trimester it is the carbimazole. So carbimazole is the drug of choice in second and third trimester, whereas propylthiouracil is the drug of choice in the first trimester, right? We avoid giving carbimazole in the first trimester, and we give carbimazole as the drug of choice in second and third trimester. What is the most common duration for secondary postpartum hemorrhage? So how was the exam, guys? How did you all do the exam? On the whole, was it easy for all of you? So primary PPH is bleeding within Thank you so much, Saptarshi. Excellent. Hearty congratulations to you. Very good, Mahesh. It was awesome that paper was easy. Actually, even I feel Obgyn questions were little easy, you know. This before this exam, there was one last time FMG exam mein Obgyn questions were very tough. This time they have given easy for FMG, right? So primary PPH is bleeding within 24 hours. Secondary PPH, secondary PPH is bleeding between 24 hours to 12 weeks. Between 24 hours to 12 weeks, right? So that is why the best answer here is B, between 24 hours to 12 weeks, right? Okay, so primary PPH, the most common cause is atonic uterus. Secondary PPH, the most common cause is retained placenta, right? Okay, a 34-year-old. Thank you, Singra. Thank you, Mahesh. Very good. I'm happy. So, a 34-year-old woman presents at 6 weeks of delivery for contraceptive advice. She wants contraception for next 3 years. What will be the best contraceptive in this case? Copper T, IUCD with progesterone, injectable progesterone, lactational amenorrhea. So again, this is one very favorite question, postpartum contraception ka question. So please remember, if somebody comes to you for contraception within 48 hours, then best is IUCD. After 48 hours to 6 weeks, go with progesterone only pill. Beyond 6 weeks, again IUCD will be the best. And she's very clearly telling that she wants a long-term contraception for 3 years. And as she has crossed 6 weeks, you can aram insert a copper T, and copper T will run for almost 3 years. Right? And we also know that we have two copper Ts which are given free by the government. That is Freedom 5. अगर 5 साल की आज़ादी चाहिए तो Freedom 5. That is copper T 375. Right? And if they want to have a contraception for 10 years, it is Freedom 10, that is copper T 380A. So the best contraception after 6 weeks and for long term will be copper T, right? Next, which of the following drug is used in MTP for a 20-year-old female who is in early weeks of pregnancy? So we all know that up to 9 weeks you have one regimen which is given with great success rate, almost 95% success rate is. So you can give day 1 200 milligrams of mifepristone, and day 3 it is 800 micrograms of misoprostol. So the best answer here is D, right? So you can use this regimen up to 9 weeks with 95% success rate. So day 1 200 milligrams of mifepristone, and day 3 800 micrograms of misoprostol. Actually, to be frank, very similar to this regimen has been launched. There is a abortion ka 2022 new guideline given by the in March by RCOG. So very soon I'll be making a video and launching that also for those who are. So guys, now FMG has come damn easy and you have all given very well and you have done very well. So I ask you to enjoy. अच्छे से enjoy कर लेना, but don't lose the continuity. Continue the same preparation for your NEET. Don't stop here. Continue same preparation को continue रखो, and internship में give your internship also 100%, learn every procedure, learn everything. Okay, so here the answer is 200 milligrams of mifepristone and 800 micrograms of misoprostol. A 24-year-old woman presented in emergency department with cervix fully outside and she has a cystocele. What is the next step of management? See, as she is a 24-year-old, obviously I can't do hysterectomy for her. Leaf oats is also where you remove everything. Leaf oats is a partial, sorry, we don't remove everything, but it is done for 80 years who are unfit for major surgeries. Anticoagulopathy alone will not help because her cervix is also fully outside. So you can put pessary for a temporary relief. So if the uses for pessary, you can remember there are 3 uses pregnancy related and there are 3 uses surgery related. So the 3 uses pregnancy related are who are planning to conceive, like this patient, she was planning to conceive, but ideal for planning to conceive will be sling surgeries, but I don't have the option of sling surgery, so I'll go with the pessary. Next, those who are pregnant already up to 18 weeks, you can give pessary support. Post 18 weeks, anyway, uterus itself will get support with the iliac bones. Next, pure perium may also you can insert the pessary. So most common pessary which we use is the ring pessary. Next, coming to the surgical management. No, surgery se pehle where all we use. Prior to surgery, if they have decubitus ulcer, not willing for surgery, and unfit for surgery. This is how I remember. So you can remember the indications for pessary: 3 surgery related, 3 pregnancy related. Unfit for surgery, right? So here you can insert the pessary for temporary relief for her, right? A couple came to the clinic with complaints of infertility. On examination, her husband had a gynecomastia and a tall stature. What is the possible diagnosis? So tall, Turner's ruled out because Turner's will be short. Now, there is a possibility that you can tell this can be testicular feminization syndrome, but it is her husband who has come. So it is a male phenotype. So Swayers and testicular feminization syndrome, dono hi, it will be a female phenotype. Both of them will look like females, but here it is a husband, so it is looking like a male. So Klinefelter syndrome mein, it is a male phenotype with gynecomastia, with small testes, tall stature and infertility. So Klinefelter syndrome is 47XYY. So this is 47XYY. Okay. Patient with breast cancer on treatment with tamoxifen. She now presents with the complaints of bleeding per vaginum. What is the most likely cause? So tamoxifen is a selective estrogen receptor modulator. It acts like estrogen on some receptors and anti to estrogen on some receptors. Now on endometrium, it is like estrogen. So tamoxifen always has the risk of endometrial cancer. So when you take raloxifene, the advantage of raloxifene is raloxifene does not cause endometrial cancer. So whenever you are giving for osteoporosis, you always prefer raloxifene on tamoxifen. So tamoxifen ka one of the disadvantages, it causes endometrial cancer as it is pro to the endometrial growth. It increases the endometrial growth. Ritodrin to prevent premature labor will cause all the complications in the mother except. So ritodrin is a beta adrenergic. So beta adrenergics mainly cause tachycardia, tremors and hypoglycemia. Very rare, less likely pulmonary edema. So that is why here the answer can go for pulmonary edema, right? So they mainly cause tachycardia, hypoglycemia, tremors, right? Hypotension. Okay. So what are and ritodrin is the only FDA approved drug. Ritodrin is the only FDA approved drug. And which is the drug of choice for tocolysis? It is the nifedipine. It is the nifedipine, right? One question of mine is, um, was the option hyperglycemia or hypoglycemia? So just check that. Okay. So which anticoagulant is not used in the first trimester of pregnancy? So we don't use warfarin in the first trimester of pregnancy, right? So warfarin is the anticoagulant of choice in the first trimester of pregnancy. Is not used in the first trimester of pregnancy because warfarin causes Contradi syndrome. Warfarin causes Contradi syndrome, right? You can, so up to 12 weeks, low molecular weight heparin is the best drug whenever you want to give anticoagulation. 12 to 13, up to 13 weeks, like 12 weeks plus 6 days, right? So 13 to 36 weeks, best drug will be, you can give warfarin. I'm not telling best, you can give warfarin. Beyond 36 weeks, again it is low molecular weight heparin. You should never give near the delivery warfarin, because warfarin will has that anticoagulant effect. And again in lactation, you can give low molecular weight heparin, warfarin. So it is warfarin, low molecular weight heparin, jumping, right? Okay. So this also again many times asked question. This is also again many times asked question. Following image is used for, again HSG is one of the favorite in the exam. So many times you get a question on HSG. So this is the Leach-Wilkinson's cannula. So Leach-Wilkinson's cannula is used. How do you identify? You have that conical spiral in front. You have that conical spiral in front. So Leach-Wilkinson's cannula is used for HSG, hysterosalpingography. It is used for hysterosalpingography, right? What is the best management for septate uterus? What is the best management for septate uterus? So the best management for septate uterus is hysteroscopic septal resection. It is the hysteroscopic septal resection. So again, this image also has come as an image-based question. So I think it is very clear that this is a placenta previa. Can you see placenta is lying on the cervix? So they didn't ask you which type of placenta previa. They just gave it as a placenta previa or abruption, or I don't know the other options. So this is nothing but the placenta previa. Next. In females, hair growth is due to which hormone? So always remember guys, hair growth is due to androgens. Androgens. So testosterone. So whatever the option which you have at the testosterone. So hair growth is due to testosterone or androgens. Okay. Whereas breast development is due to estrogen. Breast development is due to estrogen. Next, one more question which I have is, So there was one more question, that is 8 weeks, vagina is bluish in color. What is that sign? So 8 weeks, bluish vagina, bluish discoloration of vagina is Chadwick's sign. Chadwick's sign. So these were some of the questions which I got from the students, which has come, and one image of imperforate hymen was also given in the exam. So this is the imperforate hymen, right? So these were some of the questions which I got from the students. Any other questions which I missed, or which were there in the exam, guys? So any other questions which you would like to put forward, which was there in the exam and which I have missed, please let me know so that I can add it here, and we can discuss. So a quick recap of whatever questions we got, and So we had one question of vesicovaginal fistula. Today ka question pucha tha hemorrhoidal placenta. Most common cause of PMB is endometrial atrophy. When do we require more than 2 doctors? 20 to 24 weeks. More than one doctor? 20 to 24 weeks. We had an Asherman picture. Most common site of tuberculosis is fallopian tubes. First trimester drug of choice is propylthiouracil. When do you call secondary PPH? Post 24 hours up to 12 weeks. After 6 weeks, copper is the contraceptive of choice. Abortifacient agent का dose पूछा गया था. Then when there is a young woman, you can put a pessary for temporary relief. Klinefelter, tamoxifen causes endometrial cancer. Retrodrine, very less likely to cause pulmonary edema. Warfarin should be avoided in the first trimester. Leach-Wilkinson's Calua is used for HSG. Septate uterus, best management is hysteroscopic septal resection, and this is placenta previa. Okay. So any other questions, guys? Right. So those were the questions which I've collected and I have put forward. If you have any further questions, you can let me know. All the best, guys. Keep preparing. Continue your preparation for NEET PG. I bless you all that you all get more than 200 and you come out with flying colors. Thank you so much. Good night. Sweet dreams. Any doubts before I end the session? So you can DM me on my Insta or on my Telegram if you have any further questions which I didn't answer. So this is my profile. So I'll definitely answer you back. Arshan, Darshan. So there is a question about the functions of estrogen. Except. So what were the other options? There was one question of most common ovarian tumor. So most common ovarian tumor is, and I got the options as yolk sac cancer, dysgerminoma, teratoma, and germ cell. So most common ovarian tumor is teratoma. Most common ovarian tumor is teratoma. And one more question is, lady is breastfeeding and there is abdominal cramps. What is the hormone responsible for that? So it is the oxytocin. So when lady is breastfeeding, if there is abdominal cramps, which hormone is responsible for it? It is the oxytocin. Okay, because when mother is breastfeeding, oxytocin is released. Oxytocin causes the uterine contractions. Right. Thank you, guys. All the best.